appointment book. All right, when we're looking at the appointment book, there are a few things that I mentioned already. I have a schedule where I have 4 operatories, or 4 rooms, Op 1, Op 2, Op 3, Op 4. You'll notice that looking at the appointment book, it can be customized, which is nothing that an assistant will need to know. They'll be in an office where it'll already be set up. Providers will have different colors. You'll have to be aware that in our program, the provider is a color, not procedures. So the provider represents a color in the schedule. Now, first of all, we need to make appointments. So, looking at the data, you'll notice that every hour on my schedule is in 10-minute increments. That's going to be something kind of important to remember as we go along, because we'll really want to be sure how long an appointment should be scheduled for the treatment. So, first thing we're going to do is we're going to make an appointment for me because I need to be seen and I'm having a toothache and I definitely want to make sure I'm taken care of. When I navigate and looking at this particular screen, there's a few things that are going to come in handy as we're going along. First of all, when you see in the corner here, it says month. This is a quick calendar. It's a very quick calendar. If I select it, I can navigate. It just shows me days. It does not show me scheduled people. I can go forward and look at my days, go day by day by day. If I select a certain day, like November 14th, it will actually take me to that day. Well, I have some other little buttons clear to the right. I have arrow backwards, arrow forward, and today. If you ever get kind of like ski-wumpum and how did I get there, just select the little button. It'll take you automatically back to the current date. So I have my little arrows. I can go backwards. Let's see if I have any appointments last week. I can go day by day by day. I can go back to today. And of course, the front arrow button leads me to the next day, and the next day, and the next day. So navigating through the system can be very simple, day by day, forward, backward, or month by month. If you want to skip ahead a few months, not a problem. Now, there's different ways to look at the appointment book. First of all, I can look at a day, which is today. I can look at the week. By the way, you notice when I hover, you can see clearly what the icon is. When I press this week button, this shows me appointments this whole week. We have a month button. This month shows the whole month. Okay, this is not going to come in very handy. This has to do more with production, which is something we will not discuss today. But this shows you how to keep track of production, not today. So again, I have my week. I have my day. And I'm just choosing, definitely, today. This is the day we're going to schedule and look at and use. And if you're ever going to be moving appointments when people call and reschedule, there's this big, long slash that says list. It's called the pin board. We will use the pin board a little bit today, definitely. So looking at this pin board, it's a big area because I can put many appointments in there if I need to. Okay, this is kind of just navigating you a little bit on what you will see in the appointment book. The little buttons in the middle here, this is how you can find an appointment for a patient. Some patients are very picky. I can only come on Tuesday afternoons when there's a full moon and it's at 3 o'clock. This will be how you find an appointment. If a patient calls and says, oh, shoot, when's my appointment? We'll be using that one. And you can break appointments. If they call, they got sick, and they're not coming. So we're going to use a few of these buttons today. First things first. We're going to schedule me an appointment. as I greatly need it. All right, I've made a phone call. I tell them I want to come in for a checkup, cleaning, exam. You know, it's been a while. I haven't been in for 8 years. I want to select the operatory they'll be seen in and the time. I'm going to choose, let's choose 11 a.m. on my schedule today. Oh, by the way, I get this asked a lot. See that little red slash? That's just every 10 minutes it will change to the next 10 minutes when it's close to that time. That's just a little information. I'm going to be seen Tuesday the 10th today at 11. I'm going to double click that appointment time. Okay, who's going to be scheduled? There I am. That's me. I'm making an appointment. I press OK. Oh, guess what? Oh, she must pre-medicate. Ooh, she has to do it with amoxicillin. We better remind her. That is why those alerts come in very handy. I'm going to not show it again today because I already know that I must pre-medicate. Oh, and guess what? Oh, good. I'm glad she said this. She wants Sally. All right, good alerts. What does open up is my appointment information. This is pretty important on what you put on the appointment information. First of all, the first little corner is the provider. You need to schedule the patient with the right provider. I have a lot in my system. I am coming in for a hygiene visit. I would like to see Sally. That who is I'm scheduling with. This is who you're scheduled with, not who your primary dentist is. All right, I'm going to select Sally Hayes. You'll notice the provider now lets me know it's Hygiene 1. And there's this big box here, reason. Why am I being seen today? There's different ways to fill in this reason box. There's this little button that's called Initial. This will be used quite a bit when scheduling. When I press Initial, there are some basic reasons a patient comes for a first visit. You can see we have everything from EX is probably emergency or just an exam, limited exam, a comprehensive exam. Comprehensive is a new patient you have not seen. So I'm going to have that today. I'm also going to have the Panorex today, since I'm new. Got to check me out. I'm going to have 4 bite wings. And as I go down, an adult prophy. To be honest, they really haven't seen me. I don't know if I'm perio or not. Hope not. Anyway, initially, you will get to select what they're scheduled for. Treatment can change when they come in. That's not a problem. We're just putting in the reason they're coming. So I've highlighted what I need and press OK. Oh, says, oh, you already have continuing care. Would you want to set it up? Yes. There's this little box up here that is now from this visit has let the system know when I'm due again for my next prophy, my pano, and my bite wings. When I have my appointment description, it auto-defaults from the verbiage in the Dentrix program. It says Comp EX, Pano, Bite Wings 4, Prophy. This is an area that you can change and put whatever description the office likes to see. New patient recall with Pano. Okay? I can put whatever I need to do in that description. There's some boxes and little windows down below. I can actually select the staff member that made the appointment. I'm going to say Susan Jones made the appointment today. It just keeps track in the program of what any staff member does. It's something you can track to use or not use, but it is there for that purpose, so you can chart who made the appointment. You have this little status. When I do the drop down, I can convert it's an emergency, that they're here, or it's just confirmed. I'm going to put it's confirmed. We're not going to worry about any other data in here because it'll auto-default. It knows the operatory, the date, and the time. Lastly, I'm going to insert my date line. Maybe I made the appointment last week. That would show that. Okay? I'm going to put here, must another. Big note, must be Medicaid. Remember, I'm putting it everywhere. I have it in their medical alerts. I have it in a patient alert, so it pops out, and I put it on my appointment. You can put any note in there. You could put confirmed voicemail, left message with son, whatever. This is where you put notes, any notes about the appointment. Rescheduled due to illness, whatever. Okay? You can put whatever note you need on that appointment. We won't even talk about these little checkoff boxes. Every office sets up their own checkoff boxes. So just for our purposes on how to schedule an appointment, we're just going to schedule me for a new patient with a couple of notes. Now, this is something that is very important that I think is going to make a difference, that I think your assistants will need to know. I have this description, new patient, and it auto-defaults the appointment length, 80 minutes. That's way too long. Sally is super fast. I'm going to click this arrow, and when I open this, you'll notice that it's telling me, well, the computer thinks all of this takes 80 minutes. Well, Sally is amazing. She's going to do it in 60 minutes. That's how she schedules. I'm going to bring it down 60 minutes. It is in 10-minute increments because my schedule is set up in 10-minute increments. Okay, here's the big important part. You have little boxes. This actually lets you determine who is seeing the patient. In other words, an X means it's provider time. A blank means it's empty chair time. Maybe they're just being seated. A slash is assistant time. I'm going to review that again. When you schedule an appointment, you need to look at the appointment length to make sure it's the appropriate time. Even if 80 minutes is the appropriate time, we're going to change it to 60. Some offices really do keep track if it's assistant time, empty chair time, or provider time. A lot of practices, especially the dentist, really does like to have their schedule in such a way so they know that they're in this room at this amount of time, then they go to the other room for this amount of time, and so on, so they can gauge their time through the whole day. Okay, this is a checkup and cleaning. I'm going to put that the first 10 minutes is assistant time. The assistant is going to take them back and perhaps take the panel and the x-rays. Then the hygienist, the provider, comes in and she does her little work and visits and catches up. The last block, we're going to put empty. It's just chair time. The patient is waiting in the room until the doctor can come in and get the exam done. This is an example of using provider time, assistant time, and chair time. Okay, I'm set. My appointment is set up. I'm going to press OK. It says, wait, the provider's already scheduled. Double book? Yes. Can you see we have Sally working in this room? It's warning me, sorry, little delay there. It's warning me, wait a minute, see these X's? She's in this room at the same time. Are you sure you want to double book her? Yeah, because Sally and Lisa are best friends, and she said she'd squeeze her in. It's going to ask if a provider's double booked. You need to select if yes, you're going to double book it, or no. All right, we've got me scheduled. That's lovely. What we've got next is what if we have a new patient schedule? For instance, children. I needed to create a file for my family, and now we have children who will be coming in. So with that being said, I come in and I say, can I get my children in? Well, guess what? We have openings this afternoon. Let's get your children scheduled. Remember our family file? I have Philip and Lisa. In order to attach a new patient into a file, we're going to schedule their appointment first. It's critical, and it must be done right. It must be done right. So, adding a new patient. This is going to be a lot simpler than you think, but it's very, 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 very important. Okay, first of all, we have, at 2 o'clock, we have an opening. I'm going to select 2 o'clock. I'm going to look for London Davis. Oh, she's not there. Really? A new patient. I select new patient, and I enter her basic information. Whoops. Again, I'm just tabbing. Now, do you remember I already have Mom's phone number and address and all of that data? I can choose to enter it, or when I link it to Mom, it'll put it in. So for right now, since Mom is coming today, I am not doing phone numbers and addresses. However, I want to keep track of my referrals because I'm going to run a report at the end of the month, and I won't remember that Mom referred daughter in. So who are they referred by? It was a patient. It was, it defaulted to me. Okay? I referred her in, but just so you're aware, if it's not auto-defaulting to whoever you just looked at, go ahead and type it in. All right, I'm going to press OK. OK. All right. London Davis, new patient, right here. She doesn't have a provider yet. She's not in the system. Well, we're going to have London see, well, let's see. Let's do Pedo. Brenda. I'm going to see Brenda today. I'm going to press OK. Remember my reason box? Why is she going to be seen? I have this initial right here. Initial. All right. When I am actually pulling up the reasons, she's a child. New patient, comprehensive. A panel, because she's 10. 2-bite wings, because she's a child. Child prophy, fluoride child. Okay. Next step. I can change the description. New patient, child, age 10. Perfect. I go to my appointment length. Children actually go a little faster. I'm going to make this be a 40-minute appointment. My first block of time, assistant. Last block of time, empty chair waiting for an exam. Okay. Who made the appointment? Here's our staff member, Susan. And under status, it's confirmed. Remember, the rest of the data will auto-default in. I'm going to put a date line. This is important. Attach to Lisa Davis family. That's pretty important. I need to know who she belongs to. Mom has the... Oh, I'll do this. Call Mom on her cell. Whoops. Anything you want to put there. Okay. All done. Okay. Can you see with London here? It says NP, London Davis. She is not in the family data yet. What if she got sick and never showed up? We can't say that we had seen her. We're going to add another one. We're going to add Rachel Davis. New patient. Sorry. Okay. Again, I have the patient data because Mom has been seen earlier. Referred by a patient. There I am. I'm going to press OK. OK. Okay, Rachel's a little older. We're going to have her see the same provider because she's 14. I am not doing continuing care yet because we haven't seen her. What's the reason we're seeing her? Okay, she is, let's say she's 16. Comprehensive? 16. Pano, those wisdom teeth for sure are coming in. 4 bite wings. 16. Adult prophy. I change my description. New patient, child, age, 16. And has braces. Appointment length time. I am going to make this a little longer because of the braces. First is an assistant time. We're going to use all of this for provider and empty chair at the end because these are checkups. By the way, I'm just clicking the box and I get 3 choices. Who made the appointment? And the status. So looking at the status, she's also confirmed. Insert a date line. Whoops. There we go. Okay. All right. I think I've made it pretty clear on how we can go ahead and enter patients for an appointment. The next part, again, this is the most important part. You can see London Davis. It says, new patient, London Davis. New patient, Rachel Davis. It will not be in the family file yet. Okay, so mom comes in the morning, everything's lovely, beautiful teeth, brings the children back, fills in their paperwork. This is very important. I'm going to show it to you a couple of times. We attach them to the family file from the appointment book. I simply go into, by the way, if I click an appointment, it pops it out just a little bit. It puts a little gray box around it, and it pops it out. So the computer knows which patient I am working on. So London, here she is popped out a little bit. I select her name. I select it once. I go to the family file. By the way, it could be anybody. It's defaulting to me because I'm using it. I go to the word File, New Patient with Appointment. Very, very, very important. This is how you will attach it. Do I want to create a family for London, add to the current family, or select a family to put her in? I'm going to add to the current family. Okay. I now have this patient data that I can update for London. Davis, London, prefers London. By the way, this is a little important because you can run lists or set your schedule up by what they're preferred to be called rather than their real name. I tab down to status. She is now an active patient. Gender, she's a female, and because of her age, she's a child. I can put her birth date in. Is that right? Okay, that's good. I don't need her social security or other IDs as she's a minor. It didn't put the address in. This is where you'll find it because I did not put it on her appointment. If I click the arrow, there's the family address. Okay. It populates it in. It gives us a home phone number. It already attaches the providers. It'll auto-assign a chart number, and now her consent forms and paperwork has been signed. Okay. We've got London, Phil, Lisa. At this time, if London has a medical alert, I can simply update her alert. Let's put, certainly not pregnant. I'll put it on my other daughter because she really does have rheumatoid arthritis. So Hers is fine. Appointment book. London's no longer says NP in front of her name. She's a patient of record. Rachel, however, is still just a patient as a new patient scheduled, nothing on her. I'm going to review this one more time. I click her one time, and it puts this little gray box around her. I hit the picture of the family file. I don't add it here. It has to be linked to her appointment. So I go to File, New Patient with Appointment, because I'm looking at Rachel's appointment. Do I want to create a family for her, add her to the current, or select a different family? I'm going to add her to the current family. Press OK. Now I can put Rachel's data in here. She's a patient. She's a female. And she is a child. So her birthday, does that make, oh, good, that I had to guess. And then you've got her information if you choose to put in her personal data. Address, once again, if I click the arrow, the family address is attached. It will auto-update all of her information. Press OK. I can put her medical alerts in. Rheumatoid arthritis. Perfect. All right, you can see now on this particular data, you notice how Lisa has the red medical alert that I can access at any time? In fact, when I push the red sign, it gives me her medical alerts, appointment note, and my patient notes. I can see all of the notes on the patient just simply by pushing this little red plus sign, or even the music note. Just simply means there's a note on the appointment. That's what the music note is, by the way. And now Rachel also has a medical alert. Looking at the patient data, I'm just going to make this very simple and easy so we can do good on our time here today. Let's say that you have some patients like this other Davis family, Lyle and Karen, and they call, they're sick for the day, and they must reschedule. Nothing they can do about it. Just going to show you very simply. I'm sorry, it's refreshing a little bit. I apologize. I'm going to just hold on to it with my mouse and pop it into this box. So it says List and Davis. I'm also going to put Lyle. You can see what we have here. We've moved these families. It doesn't know where to put them. It's kind of keeping them here. But let's say that they're sick or their car broke down. They can come tomorrow. If I simply use my arrows to navigate forward, I'm just going to put them in tomorrow. I simply hold it, drag it in. Let's see if I can get this. Okay. Yes, it wants me to move it. Yep, I do. I want to put them there. Let me pull this other one in. It's just a click and drag. I'm holding it with my mouse. I click and I drag. That's all there is to it. Remember my little arrows, or go back to today? Now it knows how to place to put it. It removed it and replaced it. So this little pin board is a very useful tool to move patients around that need to reschedule. That's what the pin board is. That's what that is. That's all we have on this section. So the next area that we're going to review, and you're looking at your agenda here, is number 3, the Dentrix family file and the ledger.